All wounds tend to be different. Some wounds tend to be more painful than others. Some wounds tend to be infected. Some wounds aren't. Some wounds are infected with different types of microorganisms than others. Compounding allows us to custom make solutions that will help to address each individual wound and help to heal that wound in the most efficient manner. One of the strategies with wound care is perfusion to the wound. What does that mean? Blood flow to wounds is compromised. So blood flow can't get into the wounds. So nutrients can't get into the wounds, waste can't get away from the wounds, important blood cells like white blood cells that fight infection can't get into the wounds. So another strategy we have for wound care is to add things that can increase the amount of blood flow to the area, things that will increase the size of the blood vessels, things that will increase the flexibility of the red blood cells. There's three basic components to wound care. So we have to manage the wound itself, we have to manage pain, and we have to manage infection. All those are very important in managing the healing of the wound. The wound itself, often wounds will heal from the outside in. Sometimes we can create what we call granulation centers. So we can create little islands around which the fibroblasts or the skin cells can grow from the inside of the wound that can create islands that will grow from the inside out, which will help to fill the wound in quicker. Pain control is extremely important in wound management. We can treat somebody's pain in their wound topically without having to administer large doses of oral medications to treat their pain. And of course, anti-infective therapy to control infections in the wound is extremely important. Once a wound becomes infected, it could jeopardize the person's whole limb, it could jeopardize their life, and we can often control infections in a wound topically with sprays, irrigation solutions, or gels.